Okay, so it's over to you now to have a go at this simulation of a side view postural analysis. This is the same client that we saw before. I'll give you a couple of minutes to go through it and have a look and see what you can spot in terms of postural issues from the photo, and then we'll come back and I'll draw the lines in and talk you through it. So stop the video now and take a look. Okay, great. So we'll start by drawing in the plumb line. So that plumb line will come up through the front third of the lateral malleolus, the ankle bone. It should then pass through the axis of the knee, through the center of the greater trochanter, which is just posterior to the hip joint, up through the torso. It should pass through the center of the shoulder, the glenohumeral joint, if posture is perfect, and then through the ear hole and out through the top of the head. So we can see here that there's a slight shift forward of the pelvis from that center plumb line. We can see some hyperextension of the knees as well, and we can see that the shoulder is sitting forward of that plumb line. We'll look now at the head and neck posture. To do this, we draw a line that goes straight through from the point of the chin to where the skull meets the neck at the occipital region. We then draw another line which follows the curvature of the thoracic spine and passes through the ear hole. What we're looking to see here, that these two lines create an angle of 90 degrees. So if the head and neck posture is perfect, we'll see a 90-degree angle in here. You can see in this client how she was 6 months earlier. We see here a decrease in this angle quite substantially because of that forward head carriage. We can see the distance now from the ear hole to that plumb line. We can also see how much further forward her shoulders were of that plumb line and how much more rounded she was through the thoracic spine. So much more kyphotic through there. Moving on then to the pelvic tilt. In your software, you'll simply line up the 2 points on the pelvis, so the front of the pelvis at the ASIS and the back of the pelvis at the PSIS. The degree of anterior or posterior rotation will be automatically calculated for you by your software. So you don't need to worry about that, just worry about lining up those 2 points. From there, we'll take a look up at the cervical spine. So we're just indicating here simply observations at this stage. We're observing the shape of the spine. Is there a curvature in the cervical spine? Is there a decrease in curvature? Has the spine flattened out? And we just indicate that with the icons available. We'll do the same thing for the thoracic spine. Do we see a large amount of thoracic kyphosis like we did in the first photo on the left? Or has it flattened out, or is there a normal amount of kyphosis? What we want to see is a natural curve through here. We don't want it to be too flat, and we don't want to see an exaggerated curvature through there either. Moving on down to the lumbar spine, we'll do the same thing here, and we'll indicate the degree of curvature of the lumbar spine. Obviously here, because of the large anterior pelvic tilt, we're going to see a lot more curvature through the lumbar spine. So we're simply, with the icons available, going to indicate, is the spine fairly flat there? Is there normal curvature, or is there an excessive curvature through that lumbar spine? From the front view, we may have noticed that one hand jutted forward of the other in the sagittal plane. If this was the case, then we'll indicate here on the side posture what we saw in the front posture. Typically, these are the most common postures that we'll see, or you'll see when you're doing your postural analysis with people. So if we take the first one on the left, which is the good posture, we take that line straight up through the front third of the lateral malleolus again. We can see that there's a very normal anterior pelvic tilt. We're looking for arguably 6 to 7 degrees of anterior pelvic tilt. In the second image there, if we draw the plumb line in again, we can see that forward head carriage, that head sitting a long way forward of the plumb line. Remember too, with the head weighing between 4.5 and 5 kilograms, that if the head is 20 millimeters forward of that plumb line, the weight of the head doubles. Onto the thoracic kyphosis now, and we can see the shoulders, the glenohumeral joint, sitting a long way forward from that plumb line. That's causing a lot more thoracic kyphosis, so a lot more rounding out of that upper back. Onto the lumbar lordosis now, and we can see the curvature in the lumbar spine. We can see that anterior pelvic tilt fairly accentuated. The body's trying to straighten itself up as well. This person seems to also have the hyperextended knees. We often see this combination together, hyperextended knees and a large anterior pelvic tilt, but not always. Then moving on to the last one, we see the posterior pelvic tilt. So this way the pelvis is actually tilted backwards. This will now flatten out the lumbar spine, so there'll be less curvature. Interesting to point out too that in the last two cases here, the lumbar lordosis and the posterior pelvic tilt, that with the lumbar lordosis, the large lordosis, then the person is much more susceptible to what's called facet joint pain. So they'll get an irritation or a bar of pain, inflammation along the lower back and complain of that. With a posterior pelvic tilt, they're much more likely or more susceptible to getting disc injury. So we have that curvature naturally in the spine so that the spine can support more axial load or compression down onto the discs. So if the spine starts to flatten out and become too straight, it supports less axial load or compression down onto the disc, which increases the risk of injury to the disc.